Good evening. I'd like to call this meeting of the Planning and Development Committee to order. There's no public meeting tonight, but there are some things that I do need to say because when we are dealing with planning issues, so bear with me. So Planning and Development Committee will consider all oral and written comments prior to making a decision on a planning application. I will call upon staff to provide their presentation, and then the committee will be able to ask questions after the staff's presentation. And then we will go to the ones in the audience who wish to speak and have come forth as a delegation. To the committee, are there any declarations of pecuniary interest? Seeing none, we will move on. Our first item tonight is item 3, Supervised Consumption Services / Temporary Overdose Prevention Sites Planning Study Restart. April Sewin, Manager of Policy Planning, will present. Welcome, April. I'm not sure if you're aware that the one microphone is not working, so you need to be near the smaller microphone. It's the only one working, yes.
Can you hear me? Okay, thank you. Madam Chair, members of Planning and Development Committee, and staff, members of the public that are in the audience, I'm here tonight to give you a presentation on the Supervised Consumption Sites Planning Study Restart. First, to set us all in the same context, I thought I would overview what supervised consumption services are. These are sites where federal exemptions are provided to allow the legal consumption of opioids in a supervised and supportive setting. They are one facet to a countrywide crisis. So that's why it's being done at a federal level and then implemented provincially and then locally. The provincial government in Ontario has a funding program for a limited number of these sites. They've set that number at 21. Regional Public Health is looking for a viable site in Cambridge and Kitchener based on need. So you might wonder what the interim control bylaw has to do with citing a supervised consumption site. The reason that we have an interim control bylaw in place is that these are new uses that aren't contemplated in our current official plan or zoning bylaw. So at the time the official plan was done in 2012 and the zoning bylaw, which is a 1985 document, there wasn't any such thing as a supervised consumption site. So there aren't any local rules that apply to when we would cite such a site, either at a policy level that would outline broad policy, nor specifically in the zoning bylaw in terms of the regulations that would apply to such a use. So the interim control bylaw was passed last April, and that allowed us time to hire Meridian Planning to conduct the study. They were hired because they are also doing the citywide zoning bylaw. So it was a good dovetail in that while they're reviewing the citywide zoning, also they look at the zoning for these sites. So our planning study was halted in mid-2018 when the provincial and the federal programs were both being reviewed. It wasn't seen to be wise to carry on with our planning study when we weren't really sure how the rules were going to shake out at either a federal or a provincial level. So what's happening now? The interim control bylaw needs to be extended to allow time to complete the study while continuing to prohibit the use in the 3 core areas and within 500 meters of them. So that original bylaw that was passed last year prohibited the establishment of a SCS or other similar use within the core areas and within 500 meters of them. That's where Council's concern was that one get established without us having our local rules in place. So the study is going to start up again. May 1st will be the kickoff session for the public so that we can explain what the planning study is and what it isn't and what it'll be looking at. So that May 1st date has been set. It'll be in the Bowman Room, and that will be sort of the official launch of the planning study. There's been some confusion, and sometimes I get confused about how our study relates to what regional public health has been doing. So for the City of Cambridge's study, ours is the Supervised Consumption Services Temporary Overdose Prevention Sites Planning Study. And the word planning study is important. That's what the interim control bylaw is giving us time to do, is a planning study, to look at the rules around these sites, our local rules. The region of Waterloo has a similar study, but it's called a Consumption and Treatment Services Feasibility Study. Again, the purpose of our study is to look at general rules for a site locating anywhere in the city, whereas the region of Waterloo study is looking at the need for services in Waterloo region as part of the strategy to prevent overdose deaths and find a viable site location in the area of need based on the federal and provincial criteria. And that's a mouthful, but that's what Public Health wanted me to relay to you tonight. The intended outcome of our planning study is to have official plan policies and zoning rules to evaluate an application for any site. It's not looking for sites, it's not evaluating whether or not a site should go here or there. It's saying, if a site is proposed here, what would our local rules say about the ability of that site to be there? And if it's able to be there, what are the criteria that it would have to meet? The region of Waterloo's intended outcome is for them to have a site that they can operate to reduce overdose deaths. The public consultation for the city's planning study is to commence on May 1st, as I mentioned. The region's public consultation that they've been doing on the two sites that they've zeroed in on in Kitchener and in Cambridge finished up in February this year. In terms of timing, our study has to be completed by March 2020 or earlier. So if you decide to extend the interim control bylaw, it gives us that additional time to get it done. But we cannot extend it past March 2020. That's the maximum that an interim control bylaw can be in place. It's a pretty powerful tool under the Planning Act, and it's not something that's used frequently. So that's why there's a limitation on how often we can do it. The region of Waterloo plans to report on their findings of public consultation in April. So that will be a report to regional committee and council in April. I hope I've made some things clear to you tonight, and I'm happy to answer any questions that you may have.
Thank you, April. Now to the committee. Are there any questions you would like to direct towards April? She's not coming up. They're not coming up here.
Thank you, Madam Chair. Rather than a question, I just want to make a comment about the presentation. I thank you for that. It's like really, really clear, and so I think it will help people who have fears of us going forward. And I was in particular really happy to say for you to have put down there to look on even whether there is to be a site, and I think that's what everybody in the audience is waiting to hear. So thank you very much for doing that.
Thank you, Councillor Mann.
Thank you, Madam Chair, and through you, thanks for your presentation. April, it was very informative and as Councillor Liggett said, very necessary for the public. I have two questions. When do you anticipate the completion of our study? I know you said that it has to be done by March 2020. Do you anticipate it being done before that?
Yes, through the chair, Councillor Mann, we do anticipate coming back to committee in September with a public meeting for any zoning bylaw or official plan amendment. So that would be statutory under the Planning Act, and then on to council for a recommendation report in October. That time frame allows us to get the public consultation done in May and June, take a break in July and August because we don't want to be out doing public consultation in the summer months, but that'll give the consultant time to finalize all the planning documents to bring them forward to you in September.
Thank you. And if, just for a follow-up, Madam Chair, the regional report is going to be done, is done, and it will be reported on next month. How will that report impact the outcome of our report due later on this year?
Through you, I don't see it impacting the outcome of our report at all, because our report is not looking at where a site should be. It's looking at what are the rules around a site locally. So it's separate from what we're doing.
Councillor Montero?
Thank you, Madam Chair. I have a question. Is this interim bylaw, although we're applying for to March to 26, 2020, is there any mechanism that we can make this bylaw permanent?
Through you, Madam Chair, no. That's why it's called an interim control bylaw. It's under the Planning Act. What it does is it gives us time, maximum of 2 years, to do the planning study to look at what the rules are. Now, I don't know if we could out and out say in our zoning bylaw, no supervised consumption sites are allowed anywhere in the city of Cambridge. We don't know the answer to that question yet. That's something that the planning consultant would have to look at. So I think that's what you're thinking of in terms of permanent. It would be a use that was prohibited in the zoning bylaw. I'm not sure we can do that. That's what the study will be looking at.
And that was my question, is like, this is our last kick of the cat?
Yes, to get the planning study
The
done.
interim.
Yeah.
But my question was, and you answered, and probably you don't know the answer, you're going to find out, is if we say by March, say 2020, if we wanted to make a permanent bylaw, period, you can't have consumption sites and where it is now, even with the parameters that we have.
Right.
Can we do that?
Through you, Madam Chair, that's something that the planning study would have to look at. Again, it's can you prohibit a use such as an SCS in the zoning bylaw? I don't know the answer to that question.
Okay, thank you.
Okay.
But you'll try to find out.
Well, oh, yes, that's what the planning study will do. Yeah.
Thank you.
She's next. Councillor Liggett, I understand you're next.
Right.
As we did the last attempt.
Right.
So after that term, we decided we didn't want them anywhere in the city, so now they're not allowed in our city.
Right.
So to me, I see this as exactly the same, it's just the use of the land is just different.
Through you, Madam Chair, that's something that the consultant will look at and make sure that any zoning bylaw we pass will stand at that test, that we're allowed to do that.
Okay, so the tests, when you say that test, what are those tests? What?
As professional planners, is this a use that can be prohibited through a zoning bylaw?
Okay, just following up on this, where, just out of interest sakes, where would you even find a list of what can't be prohibited under a zoning bylaw?
That's through you, Madam Chair. That's what we'll be exploring through the planning study, is whether or not such a use should be prohibited in the zoning bylaw.
Okay.
Okay.
We can talk later.
Let us do the planning study.
Yeah, as a reminder, try to keep it to questions. Councillor Wolf.
Through you, Madam Chair, and this is just more clarification.
Okay.
If the purpose of the study is not to find a location, can one of the rules be location?
Through you, Madam Chair, I'm not sure I understand the question.
Okay, right now the interim bylaw applies to
certain locations in our city, correct? So
Geographic
yes.
locations. So, and you just said that the purpose of the study is not about location.
Right.
But I was wondering if one of the rules can be about location.
Through you, Madam Chair, Theoretically, yes. For instance, in a residential zone, you can't have certain commercial or industrial uses. That's the purpose of zoning. So it would be looking at zones. Where would such a use be appropriate? Where would it not be appropriate? Or would it be appropriate at all?
Okay, thank you.
Okay.
Thank you, Madam Chair. No, I didn't have a question.
Pardon? Before you speak, Elaine Brunshaw would like to supplement some information, if you may.
Thank you, Madam Chair. So as follow-up to Ms. Suwan's response, the planning study is going to look at which designations in the official plan might be appropriate to have a supervised consumption service, which zones may be appropriate in the zoning bylaw to have a supervised consumption service, and regulations can be included in the zoning to say that they have to be set back a certain distance from other types of uses, and that could be accommodated through the planning study and would be analyzed as part of that. Thank you.
Okay, Councillor Mann.
Thank you, Madam Chair. My mic was being tested. That's the only reason it's on.
Yeah, you might have noticed we're having a little problem with the technology up here, but I think we've got it organized now. Councillor Liggett, is there a further question?
Ms. Brunshaw, your comments there. So are you saying that the study cannot look at whether or not a safe consumption site can go anywhere in the city?
It would definitely be one of the options, Madam Chair, that would have to be looked at, is nothing at all being permitted citywide. What are the implications of that versus which official plan designations or which zone categories a use might be appropriate within?
I just want to make sure that we aren't restricted to certain things, that if we decide that we don't want it anywhere in the city based on what the public is telling us or based on what we think as well, that we aren't cut out at this point if we just don't leave that out there. Okay, thanks.
I have no further questions, so I thank you very much, April, for your presentation. And now we will move to our delegations, and we have a few that wish to speak tonight on this issue. Just a warning for delegations that you have to use the smaller microphone, which might be a bit awkward, but we won't be able to hear you properly unless you do. So our first delegation is Lynn Gates. Welcome, Ms. Gates.
Thank you. Let me just get here. Okay, and then I have to do. Okay, so it's just down here. Okay, hello, and thank you for letting us speak tonight, Mayor and councillors. First of all, we want to thank you for creating and upholding this bylaw and defending the interests of citizens and businesses in the downtown core of Galt. We understand that it's important to strike a balance between citizens in need and the rest of the community, and we respect your decision to proceed with caution on consumption treatment service. We are here today to support the bylaw and your upholding of the bylaw, and we hope that you can make it a permanent bylaw. So we have presented tonight a petition. You will receive copies of 45 pages of signatures. Among them, we managed to speak with 90 businesses in Galt's core. Among those 90 businesses, we have 198 signatures because in many of the businesses, multiple employees signed, and occasionally customers who were there also said they wanted to sign. So we'll just show you, oops, it's not going to the next slide. Sorry. Okay, technical difficulty.
Oh, there we go.
Okay, so we're just going to scroll through some of these 90 businesses. On the right side, you see the number of people per business who signed. And it is quite unanimous in Galt's core that they're very concerned about the location of one of these sites. There are multiple reasons, but it's mainly the health of the city. Now, there's something I didn't make a slide about, but I'm going to briefly mention the Guelph issue, because I've heard multiple councillors say that you visited Guelph and it's wonderful, there were no problems there. But there are some major differences between our core and Guelph's. Guelph is a thriving central downtown core, and there's something else to consider. We have more shelter beds per 100,000 people than any other city in this region. We have 75 beds per 100,000. Kitchener has 61. Guelph has 44. Brantford had 39, but they've closed one of their shelters or are in the process of closing it. They'll go down to 14 beds. Waterloo has 0. We have 98 beds in Galt. Guelph, on the other hand, has 52 beds. Their men's shelter only has 22 beds. I think they have a much better model there of separating the shelter beds. They have 22 for men, 16 for women, and 14 for youths. Their men's shelter, the Stepping Stone, is, and get this, a 46-minute walk to their overdose prevention site. It is not a 10-minute walk or a 5-minute walk. So they have not followed what our local public health is insisting on, which is that it has to be near the shelter. So I think that's something to keep in mind when you consider the Guelph model. Okay, we also petitioned residents. We got signatures of those who were in the 250-meter zone at the public health consultation meeting, and we just went to a couple of streets near downtown Galt, and in a couple of weeks we got 376 signatures. This was not done online, this was done face-to-face. So you also have those. Also, okay, so yeah, those were the, and when we were at the meeting for those in the 250-meter zone, I live in the 250-meter zone, and I was at those meetings. That was near unanimous opposition to the location of this consumption site in our core. There are a lot of reasons that we support it. One of them is obviously the location close to the school, as many of you have probably already seen. This is the view looking from the fence at the back of Central Public School. It's just really just across the street. It's far too close. We also want to remind everybody that Galt is really unique. It's not like Guelph, it's not like Kitchener, it's not like Calgary, Lethbridge, or most other cities. Our little Galt core is only about 10 square blocks, and just yesterday when I walked down between Main and Water, as many of you know, there are 14 empty storefronts. This downtown core is suffering, and removing some of the services from this core may encourage businesses to decide to come. I think we'd all love to see Galt become like Paris or Elora and be an attraction again, and I think we all hope for that. All of Cambridge's downtown cores are small compared to any other city with a consumption site. And so excluding our cores from this is very wise, because there is no other city in Canada with such a small core hosting a site like this. Thank you.
Thank you for the opportunity to present to you this evening on behalf of Cambridge Safe and Strong. My name is Angela Raposo. Over the past year, new information and studies have brought light to the negative impacts that such sites have brought to other communities where they have been placed. Public health reports that there will not be an increase in crime and that these sites will help with needle litter. However, evidence from established sites across Ontario and other provinces point to the exact opposite. In a recent statistical overview from Calgary Police Services, after a CTS was established in November of 2017, crime within the 250-meter buffer zone in 2018 increased drastically. These stats use a 3-year average. a 276% increase in drug-related crime calls for service. And included in this are the increased reports of needle litter and garbage within that 276%. There was a 47% increase in violence, a 45% increase in break and enters, and a 63% increase in vehicle crime. This report does not speak to the increase in prostitution, human trafficking, and drug trafficking that occurs near the site. Toronto's The Works at Yonge Dundas Square opened in August of 2017. 1 year later, a study from Ryerson published that crime went up 86% since opening. Reported crime ranged from assault, sexual assault, robbery, and assault using various weapons. The dean of the Chang School at Ryerson, Marie Buncherginia, had to close the assignment drop-off box because drug users were discarding their used needles there. According to Chief Larkin, during his February 6th regional budget presentation, Waterloo Region is above median in violent crime across Canada. In 2018, the region saw an increase of 11% in nonviolent crime and 23% increase in violent crime. He also noted that specifically, substance abuse and substance use is the driving force behind the significant amount of crime in Waterloo Region. Chief Larkin reiterated that to the Global News earlier in July of 2018, stating that addiction drives a significant amount of our crime, break and enter, theft from vehicles, shoplifting, etc. Public health in the City of Cambridge cannot ignore these solid statistical fact-based studies and reports. Substance abuse and substance use, specifically a consumption and treatment service center with illegal drugs, when illegal drugs are being consumed, will drastically increase all facets of crime within our neighborhood that it is established. Another concern we have is the locations of hotspots that public health has established. In 2017, the heat map public health provided showed hotspots in all 3 city centres in Kitchener, Cambridge, and Waterloo. During the most recent public consultation, the Waterloo hotspot has virtually disappeared. These hotspots of overdose calls is where public health deems a consumption site needs to be placed. However, if one is to conduct crime mapping using the Waterloo Police Services online tool, you will find that Waterloo has the most drug occurrences than anywhere in our region. Zone 6, which is...
Could you kind of wind up your talk, please? That second tinkling bell means that your 5 minutes is up.
Or we have 10 minutes.
We have 10 minutes.
You are expecting 15 minutes?
No, 10. We were told we have 10.
Well, someone neglected to tell the chair that you had 10. So we were counting on 5 minutes for each of the delegations. Okay, you may continue.
Thank you. Zone 6, which is the Rim Park area, sees the most drug occurrences in the entire region. In 2017, Waterloo Zone 6 had 248 occurrences, Kitchener Downtown had 112 occurrences, and Cambridge Zone 4 had 102. In 2018, Waterloo Zone 6 again had 134 occurrences, Kitchener Downtown had 116, and Cambridge Zone 4 had 73. Every year for the past 10 years, Zone 6 Waterloo has seen the most drug occurrences than any other zone in the region. Over that 10-year period...
I hate to keep interrupting you like this, but they tell me that you have had 10 minutes already, so if you could kind of come to a conclusion that I want to be fair to everybody here and try and keep us to our timelines. So I would ask that you please come to a conclusion at this time.
Okay. In conclusion, for myself...
Excuse me, I think Councillor Liggett, did you...
I'd like us to have a motion to allow them to complete their presentation. I think this is an extremely important event here tonight.
And...
It's okay. It's okay.
Hold it. A motion to extend this particular group.
Yes.
You've heard the motion. I'll second it. It's been seconded by Councillor Devine. Is there any discussion on the motion? Seeing none, I think you're ready to vote. Those who would wish to extend, it seems it's unanimous. You may continue.
Thank you kindly. Every year for the past 10 years, Zone 6 Waterloo has seen the most drug occurrences than any other zone in the region. Over that 10-year period, Waterloo had 5,207 drug occurrences, Kitchener saw 5,251, and Cambridge only had 4,073. Yet Waterloo, having the most drug occurrences, only has one free needle location, and Cambridge, with the least drug occurrences, has 4, as well as Sanguine Van, all located within our small downtown core. We strongly agree that the interim bylaw 5518 be extended, and we also agree that we restart the city planning study. Thank you.
In closing, Madam Chair, councillors and concerned public who have attended, our citizens group, Cambridge Safe and Strong, want to emphasize that we want to contribute and be part of the solution to this terrible scourge that is destroying lives and families in Cambridge, Waterloo region, and indeed around the world. However, we feel that repeating policies that have been proven to fail seems foolhardy. I only have time to summarize one study of many that show the failures of injection sites similar to what is being proposed here. In 2009, criminologist Martin A. Anderson did a study at Simon Fraser University about the Inside Injection Site program on East Hastings in downtown Vancouver. His conclusions estimated that perhaps 3 lives were saved from overdose due to these sites. However, the same study by Jennifer Vishloff, who interviewed frontline nurses, found that a significant number of impressionable and at-risk young people were attracted to the lifestyle of the drug culture and soon became victims of drug-induced psychosis. This medical term acknowledges that drug abuse precedes and often leads to mental illness. The conclusion is that centralizing all services and ghettoizing communities can destroy neighborhoods, actually increase the incidence of drug addiction and mental health issues, and do little to help those whom we are trying to help the most. It is obvious to all of us here that the number of people suffering from these addictions and mental health issues is growing rapidly. Too often, good intentions are blind to unintended consequences. I've already given one example of the luring of at-risk youth into the culture. The current injection sites in Toronto have no age limit, and locally we have no clear policy on that. What a mixed message to our youth. Don't do drugs, but do them safely here. There's no policy to discourage pregnant women from using the sites, nor educating them about the horrible consequences to the unborn. At this time, public health has no mandate to make counseling a major component, with the goal to help them begin the very difficult journey to recovery. We have already addressed the issue of accompanying crime as well as destruction of the communities as other unintended consequences. We all here feel compassion and desire to help people who struggle with drug addiction, mental health issues, and homelessness. However, we must seriously question whether the installation of these sites are indeed compassionate. How can enabling someone to continue a destructive lifestyle with the likelihood of a miserable death be considered a compassionate act? Our goal must be twofold: to assist those that are already struggling to begin the very difficult process of recovery, and, more important, to use our resources to help our youth experience positive activities that will help them make healthy life choices so they will not become another statistic. In closing, we have one last question we'd like to pose to our attending regional council representatives and to bring to regional council, and perhaps it should go to the provincial government too. What process did the region or the provincial government use to decide to give public health the task of selecting the CTS sites in Waterloo region? Through no fault of its own, public health is not qualified to perform such a task. This is paramount to having the planning department operate the sites. Public health has neither the expertise nor access to data to perform such an important task. This has unfairly created an environment of distrust in the community towards public health. The role of public health is to work toward the health of the entire community, not just one extremely small segment. Thank you for your time.
Thank you.
Thank you for your presentation. Now to the committee. Are there any questions that you would like to direct? Oh, okay, there you go. Mayor McGarry.
Thank you very much for your very thorough presentation, and I've had to take notes because there's 3 of you, so I could remember some of the points I wanted to make. So I just really wanted to make a couple of comments and then a question at the end. I know that at the beginning of the presentation you were asking whether we could make this a permanent bylaw, and I think you heard some of the answers from Ms. Suwan's and Ms. Brunshaw's comments that it's the planning study that will let us be aware if and when we can actually do that. Secondly, I wanted just to talk a little bit about the Guelph site that I visited as well. And I do know that we asked specific questions too to see if they actually observe an impunity zone of 250 meters around the building, and they do not. And the police are very much involved with this site, so if they note that in the public health building that somebody is loitering and they're a bit suspicious, they're able to approach the person and help to figure out what they need to do. If somebody's selling drugs out the back parking lot out of their car, they're also apprehended so that they don't observe that 250 meter zone. The walking guidelines that public health has put into place during their search for a site was based on interviews with those who may use the consumption and treatment sites. We also asked the Guelph people whether they are walking further than that, and certainly they are. We as regional council members here, I note that Councillor Jowett and Councillor Kiefer are here in the audience with us, and we have already started to talk to our regional council members regarding possibly adding transit with tickets for anybody that will use the site, so you're not tethered to one site by 10-minute walk, which isn't realistic. And the regional chair likes to point out that when she was campaigning and spoke to a family in Hespeler, she says, oh, the consumption treatment site in Galt, how would somebody in Hespeler use that if they were walking? So there are certainly different opinions about that. I also wanted to just point out that on the drug occurrences, which have quite a few in Waterloo, again, when we've sort of done a deeper dive with the police officers about that, those drug occurrences are more like theft and dealing and those kinds of pieces, but they are, what we are concerned here is about the overdose and the overdose calls. And the overdose calls are on that heat map, as you've seen in the red zone. So although it's a drug occurrence, it's not the same as an overdose. And public health is certainly based on harm reduction. And that is their role. That is their role for the region, and it's one of the reasons why they are choosing the site. But I will tell you that it really is up to the politicians in the end whether that site goes forward in that site as well. I have heard that from our regional chair, and I'm going to end off with just really a question that I've heard her ask and is something important to me as well. I certainly support having an interim control bylaw in the downtown cores plus the 500 meters around it. But my question to you is, what would you do then for that harm reduction for individuals that really require not only wraparound services, but the ability to really stay alive until they can actually reach out and have those services when it's convenient to them?
Well, just to address that quickly, as we've known for a few years, the majority of the overdoses are happening in people's homes in the suburbs. It's not happening in the cores. And I even have a family member who died that way. And I think there are things that are being looked at, phone apps for people that are alone that can maybe, let somebody know that they're using. But there has to be solutions that reach out where the people are actually dying. And I don't think these sites are necessarily attracting those people. It might be the same group that's using. And I also feel that having a model of harm reduction treatment, but not having enough treatment, means people are stuck in the harm reduction part of things. They're not getting to the next step. Did you want to talk about?
Could I just follow up to that individual, Madam Chair, through you? And I would certainly agree that there are many individuals that would not potentially use the site. It was another why I brought forward the motion to look at the feasibility of having it in a hospital area. And what we envisioned was a separate clinic that was based on the geography of where their hospital was. It wasn't intended to be in the hospital where they would be interacting with staff, but it was really there for the anonymity. For those that may be using at home alone, if they were provided with transportation so that they were safe leaving after using, that was one of the reasons why the hospital was actually brought forward. And there's another thought, it's coming.
The hospital is a great place to do it.
Yeah, it was a comment. So, and my question is, are you aware too of the methadone clinics that actually have folks coming and traveling from other cities in order to actually take their daily dose of methadone?
Yes, and I know there's one in 150 Main, but there's a huge difference between somebody who's coming to try to stay. You know, people that are coming for methadone are not stealing bikes. They're coming to maintain their dose, and I don't think we have a problem with that. I think that's actually a good solution for people, but it's not the same as a site where people can bring in illegal drugs and inject them, and we have a lot of concerns about that.
And I'm through you, Madam Chair, just one more comment about that. It was, my point too was that at those clinics, I was very familiar with the one in Kitchener when I was actually a care coordinator through Grand River Hospital, and I would send my patients out every day to get their dose. And the folks there said that they daily had people coming in from Brantford, from Woodstock, and as far away as Guelph for the anonymity. And it's another reason why the hospital or some kind of clinic based around our hospital was one of the ideas that we had in bringing that forward. Thank you.
Your Worship, I just want to make a comment.
We still have people who wish to speak, but I would like to say I'm being very lenient tonight. You've got me on a good day, I guess, because we are supposed to be just asking questions at this point and not debating. I have Councillor Liggett.
Thank you, Madam Chair. So to follow up to one of Mayor McGarry's comments, when she spoke to you about the Waterloo stats, you're not just concerned with the overdose stats in there, you're also very concerned with the other ones that are mixed in there, the crimes, the break-ins, the dealing, all of that as well, right?
Yes, I think the reason why the drug occurrences are brought up is because the drug occurrences is from possession as well, right from possession to trafficking. So it's where the drugs are. And I know that the public health likes to say, well, this is where the overdoses are happening. But that's not to say that overdoses aren't happening in homes, in other communities besides downtown. We just might not be getting reports of it. So a mild overdose could be happening in someone's home and then they recover from it. But if it's downtown and someone's street involved and they're having an overdose, there's services there, there's people there who are providing services who are going to call to get that 911 call, and those are the calls that are being recorded. We're not getting the recordings of the people who are in the homes who may be experiencing an overdose. So I just wanted to provide information about drug occurrences in Waterloo Region, just to show that it's not just Galt that has the drugs.
Yes. Yes, that was my point of my question to you. I wanted you to clarify that that's what you people feel is also very important. Thank you.
I have no further questions, but for you, sir, we did not have your name. Could you please tell us who you are and where you live?
So I am Rick Hilborn, and actually I live in Highland Crescent, but I'm also the owner with my wife and my daughter and son-in-law at Hilborn Pottery on Park Hill Road. So we are one block from the bridges, and we see occurrences all the time. Thank you.
Thank you very much, sir. Continuing on with our delegations, I would call upon Ann Tinker.
Thank you, Madam Chair and members of the committee. I've had many years of experience working with individuals who use substances, and I continue to work with individuals in recovery. Region of Waterloo Public Health began looking at the issue of supervised consumption sites in 2017 and have held several public consultations. In January of this year, a report to the Community Services Committee, the region produced a Made in Waterloo Region Consumption and Treatment Services model, which outlined a constellation of services including addiction counseling, primary care, referrals to treatment, peer support, and mental health services. A variety of community partners have already been engaged that include Langs and Sanguine Health Centers and the House of Friendship Rapid Access Center. Last Tuesday evening, I attended a board governors session at the Galt Country Club presented by the Cambridge and North Dumfries Health Link Sub-Region Planning Committee, who were looking at the provincial transformation of the healthcare system. They are considering becoming early adopters, suggesting that Cambridge and North Dumfries become an Ontario healthcare team. This group, which included Cambridge Memorial Hospital, Canadian Mental Health, Stonehenge, Langs, Fairview Mennonite Home, Community Support Connections, Grandview Medical Center, and other healthcare providers, have identified individuals with mental health and addiction issues as their potential specialized patient population for their application to the province for this Ontario Health Team. In developing their model, one of the key components is self-management and support, or harm reduction. Supervised consumption sites and their wraparound services and supports fit extremely well into this concept currently under development. What could arguably be called the worst drug crisis in human history because of its global impact continues to take its toll on residents in Cambridge and the rest of our region. Last year, paramedics responded to 843 drug-related calls, and there were 50 overdose deaths. In the first 2 months of 2019, 14 individuals have died of a drug overdose. Every weekend, between 1 and 5 people visit the emergency department of Cambridge Memorial Hospital having overdosed. So I would respectfully ask that you not extend the interim control bylaw, but instead work together with the other 2 groups already considering this issue to come up with a more timely solution in order to save lives and to design a Made in Cambridge and North Dumfries model. And if 150 Main Street is not the preferred location, would not a collaborative approach to finding one be more successful? While we might like to think that intravenous drug users are somehow not like us, they are us. They are someone's family, and they're members of this community. Surely it is incumbent on us to use any and all tools at our disposal to keep people healthy and to provide as many opportunities as we can for hope and change. Thank you.
Thank you. To the committee, are there any questions? Councillor Devine?
Yes, Ann, how are you?
I'm good, thank you.
Good. That group that you spoke about, I didn't get them all down. You had CMHA, Langs, Fairview. Can you run them off, please?
Cambridge Memorial Hospital, Canadian Mental Health, Stonehenge, Langs, Fairview Mennonite Home, Community Support Connections, Grandview Medical Center, and there were several other medical centers there, Hospice of Waterloo Region. They're all involved in this Cambridge and North Dumfries Health Link Sub-Region Planning Committee to respond to the province's decision to blow up the Lynn's.
Thank you.
I have now Councillor Wolfe.
Through you, Madam Chair. Thank you for your presentation, Anne, and for all the work you've done in our community over the years. I like the idea of the collaborative approach to finding a location. If we extend the interim bylaw, that could still go on, couldn't it?
It could. What I see happening right now is that the region's over here with public health, and they're all their consultations, and they have come up with a model. This group, which is working to be an early adopter of these Ontario healthcare teams, so that Cambridge will create its own team and not have the province mandate what it will look like. They have identified that their priority will be mental health and addictions. So they're also working on this, and you're working on it.
Right.
So, I mean, my comment is, maybe 150 Main Street is not the right place to have it, but if you all work together in a more collaborative way, wouldn't that be a better solution to have a Made in Cambridge model?
I agree, and I think that with our interim bylaw, if I understand it correctly, and I can ask Ms. Brunshaw, we can remove that interim bylaw at any time if we found a site that's, let's say, 450 meters outside the core area, so it is supposedly in the restricted area. But if we found that, decided that that's where a site could go, we could remove the interim bylaw. Is that, I just want to double check.
Madam Chair, Councillor Wolf is correct that if Council decides to extend the interim control bylaw, Council could also repeal the bylaw at any time or pull back on the boundaries of the bylaw at any time within the period of time that it's still in effect.
Thank you. Okay, so no matter how this vote goes today, I hope that we will look at a collaborative approach, as you've suggested.
Well, and we have lots of agencies that are already working together with vulnerable populations that are willing to collaborate on this issue. So I think the only thing I would say is that people...
I have now Mayor McGarry.
Thank you very much. It's mostly a comment, but there will be a question at the end. Were you aware, actually, that work is going on behind the scenes with a number of us trying to identify candidate sites?
I had heard that.
Okay. And I thank you, actually, for the list of others that are looking for that area. The interim control bylaw, as I understand it tonight, is just looking at certainly the downtown cores and 500 meters around it, but just wanted everyone to be aware that we understand that people are dying. That is why the regional chair often asks at the end of any discussion that she has, and what we're doing as well, what is your solution? So I very much appreciate listing some of the other agencies that are out there trying to ensure that we have better health for all in our community. Thank you.
I have no further questions, so thank you very much for coming. And now we'll move on, and I have Sherry Roy. Welcome, Ms. Roy.
Thank you. Good evening, Mayor McGarry, those on council in attendance, the staff, and members of the community. Thank you. My name is Sherry Roy. I am speaking tonight on behalf of our grassroots community group, the Voice of Cambridge, Kitchener-Waterloo, and for a Clean Cambridge. Collectively, we are asking for each councillor to support the extension of the interim control bylaw 15-18 to extend to March 26, 2020. We also wish to state that we encourage City Council to actively pursue amending the current zoning bylaw 150-85 to incorporate new regulations that not only reflect preventing consumption sites in the 3 downtown cores, but any other location in the City of Cambridge permanently. We ask that all council members and our mayor remain steadfast in their commitment to their constituents, listening to their concerns regarding the negative impacts that consumption sites bring to its surrounding neighbors and businesses, and rejecting all site selections presented from region or otherwise. Having spoken with our MPP Belinda Carr-Halios, we were informed that to be approved for a consumption site at the provincial level, there must be approval from local government. Belinda was clear in her letter addressed to Catherine McGarry dated March 12, 2019, that she supports the concerned citizens and business owners of Cambridge and encourages Council to vote against any and all sites within Cambridge. We ask that every ward councillor for the City of Cambridge and our mayor recognize that and make it absolutely clear to the Ministry of Health, Public Health, and the region that no approval is given. We also know that Council has had the opportunity to hear from a forthcoming police officer from Southern Ontario with detailed knowledge of the damaging effects consumption sites have on cities. The competition between drug dealers for the turf surrounding the site, the increase in human trafficking to fund drugs, and the associated crime that follows with it. I hope his expertise weighs heavily on your decisions regarding consumption treatment services. We have the opportunity to be the leaders in providing for the four-pillar model if we focus our efforts just beyond harm reduction and work to expand our efforts into detox, rehab, affordable housing, and mental health facilities. We have business owners and homeowners in cities with consumption sites who I will personally describe as persons with lived experience. They can attest to the drastic rise in crime around consumption sites, a rise in needle debris and public nuisance calls, a reduction in clients to their businesses resulting in a loss of profit. And we know that in Calgary and Toronto, additional funding was required in the hundreds of thousands of dollars to manage that rise. The current CTS model does not work. If we look to our Cambridge downtown cores, we can agree that businesses are struggling already with the saturation of social services creating a hotspot. Consumption sites across the country have proven to fail to address or assist in the reduction of overdose cases, crime, discarded needles, trafficking, and community harassment. Just yesterday, a community member shared a reply from her ward councillor, Pam Wolf. Pam stated that she had had the opportunity to tour the Guelph OPS and that she met with the mayor, police, and staff there. It's reported that no crime had increased and they had positive reports from nearby businesses. Yet, when we took this statement and shared it with residents of Guelph and business owners, they overwhelmingly disputed this statement. Guelph is relatively similar in population size compared to Cambridge, but is not equal to the number of vulnerable persons it serves due to our many social services and charities supporting them. With that in mind, Guelph residents report a visible increase in crime and needle litter, more tent areas with scattered debris, that children's parks or schoolyards aren't safe from discarded needles, which again is against the Children's Charter of Rights, or the drug users loitering in the area as a result of the consumption site offered in their downtown core. Guelph residents frequently comment to the destruction of their downtown and state that they simply do not go there to shop anymore. One local resident works in the downtown core and reports that she is harassed daily, and sometimes panhandlers get angry when she says no to them. It was also reported in the Guelph newspaper that an apartment building directly across the street from the OPS is frequented with the homeless and drug users. They find drug paraphernalia, used needles, feces, and trash in their lobby and stairwells. From supporters of sites, we often hear, people are dying, we have to do something. A direct quote from our Mayor, Catherine McGarry, I think we're a compassionate community. I believe many individuals feel that we should have something in order to try to prevent some of the opioid deaths that are happening. My response, we are doing something to try and prevent some of the opioid deaths. The Free Needle Exchange has drastic a slogan that tells drug users not to use alone. We have outreach workers, mobile units to connect drug users to health care. We offer shelter at bridges, food and supplies through various charities and organizations. We have the Rapid Access Center and numerous methadone clinics across the city. The city funds the Ambassador program to help aid in the cleanup of improperly disposed needles throughout the city. But all of these services keep a drug user dependent on the daily ritual they create for themselves. Investing in consumption sites promotes harm production, not harm reduction. Professional recovery centers tell families and friends of addicts that they should do everything to support an addict in getting clean, but never enable them in any way. There is much to be said for tough love. Addicts need services that provide them the opportunity to live a fulfilling life without drugs. As a community, we should be working towards stopping the cycle, not enabling it. In regards to the planning study, the planning committee had this to say, and I quote, "The new study, which will include public input, will not be about the appropriateness of a region's candidate site, but will set out local framework in which such uses will be regulated through the city's official planning zone bylaw." End quote. If the purpose of the planning study is to find suitable location, I ask again that Council reject the model of consumption sites and not entertain any proposed locations within the City of Cambridge. To quickly summarize again, we ask for Council to extend the bylaw at this time and work towards a permanent bylaw to prohibit consumption sites in Cambridge as a whole. Thank you.
Thank you, Ms. Roy. Now, to the committee questions. Mayor McGarry?
Thank you very much for your presentation. And at the beginning of your talk, you talked about your conversation with MPP Cara Halios, and it is her provincial government, or the provincial government, is actually going to be funding the 21 sites. So I know that she is steadfast against a site here, but did you ask her if she had addressed the 21 site with her government in order to stop all of them?
Oh, I'm sure that she's working on that. She does.
Government is going to be funding 21 sites. And are you aware, too, that a site can still be established in the City of Cambridge once an exemption is applied for from the federal government, and it could be funded by other means? So my question is, were you aware that that is one of the reasons why we're putting the planning study forward, in order to have some rules around that in our zoning bylaws?
Well, with the planning study, it really hadn't come, nobody had made any specific statements about what the planning study was for up until just yesterday and today. So I would hope that that is what the Planning Council or the planning study is for, but I have my doubts, is all.
Thank you.
And we have Councillor Liggett.
Thank you, Madam Chair. Question for Ms. Brunshaw to do with the presentation. And maybe we can clear it up for myself as well as the presenter. When we do the interim control bylaw, that is strictly for that specific area, and then we can do another additional year. But we cannot change the purpose of that bylaw during those times, other than the one time where we just added that another part of the alphabet, I call it. Because then it makes that interim control bylaw moot. Like if we were to try to make it throughout the whole city at this point in time, that can't be part of this bylaw because it's not the geographical area that we had already determined. Am I correct?
Madam Chair, the question that's posed by Councillor Liggett is looking at citywide, but there would be some areas of the city that you couldn't apply the interim control bylaw because they have had interim control bylaws in place in the past, and the Planning Act does not allow a municipality to pass another interim control bylaw for at least 3 years in areas where you've already had interim control bylaws. So there'd be some gaps in that, but theoretically you could look at passing a whole citywide bylaw. We think, though, that the recommendation from staff still allows adequate planning study to be continued to take into consideration the issues that we're hearing tonight. We're well aware that a variety of different scenarios need to be looked at, and the area that was focused on by Council in April of last year was the core areas and the surrounding 500 meters, because that was the area of interest at the time, and so we're still recommending continuing with that rather than applying it across the entire city with some gaps in areas where there have been other interim control bylaws within a 3-year period.
Sure, thank you. I appreciate that. I understood that, but I think the presenter, the people in the audience, and the people watching also needed to hear that, so thank you very much.
I have no further questioners, so I thank you for your presentation. And the next one is Cindy Watson. Welcome.
Thank you. So I'm going to be talking about supervised consumption, but I'm also going to be talking about amalgamation and how that will impact the current interim bylaw. Okay? So I want to thank Mayor and Council and the Chair for this opportunity tonight to speak about the interim bylaw And I see this bylaw as a small part of a bigger picture. And I'm here to ask that this bylaw be extended. But we also need to consider that a possible amalgamation could reverse...
I'm going to have to stop you. We can't really talk about amalgamation tonight, but we're here to talk about the interim bylaw. So if you would restrict your comments to that, I would have truly appreciate it.
Okay, so in terms of this bylaw, we need to make sure that it's going to stick. And unfortunately, we know that in the future, there's a chance that this bylaw could be by the wayside. And when we consider the interim bylaw, of course we care about people who are addicted to drugs. And I've heard from many people who are concerned about people who are addicted to drugs. And so if I'm going to be asked, well, what plan do you have? I think the best plan is to look at what we can do as a city council, what we can do as a regional council to make sure that this model changes. This current model is broken and it breaks communities, and it's that simple. And so we've heard tonight all of the effects, whether it's public injecting, needle litter, whether it's crime rates going up. We know that. And so we have to, as a council and as a community, make sure that there are checks and balances and that we're looking at ways to support our downtown core, which can be very fragile, as well making sure that we are also looking for ways to help people who are addicted to drugs. We all know that Mr. Nijkamp has been crusading this hydromorphone model. And so instead of asking where do we want this model to go, we should be asking ourselves, let's improve the model, and then that way we cut out those who are addicted to, those who are going to deal drugs. We cut out prostitution. They would be under the care of a doctor. They would be given, and it would be much like the methadone clinic. And so the question really isn't where should we put it. The question should be let's do everything we can. Let's work together with our regional partners. Let's work together as a city council, and let's lobby the province and make sure that they hear that we don't want the broken model, that we want them to fund a model that actually helps people who are addicted to drugs. If we had the hydromorphone model, and as I said, this is Dr. Nijkamp's idea, if we had that model, we could be assured that people would get the help that they need. And not only that, but it's easier to get off of this hydromorphone and to get into treatment. And we know that Insight, they're actually moving towards this model in that area, and they're experiencing success. And so, you know, we need to work together. And as a community, I don't think you would hear as much of an outcry if we had a model that actually did a better job at helping people who are addicted to drugs. And so I suggest, why don't we as a council write a letter to the province tonight? Why doesn't someone move a motion? Let's write a letter to the province and say, you know what, we want you to fund this hydromorphone model. Let's also write a letter to the region. We really want you to write a letter, and let's look at let's look at getting a model that actually helps people who are addicted to drugs, that still leaves a community intact, and businesses are still able to thrive, and we don't have to put a model or look for a place where nobody seems to want it. And so it's really the model that we need to look at, as in my personal opinion. And I'm hoping that as a council, we can be proactive and lead the way and write a letter to the province and ask them to fund this better model. Thank you.
Thank you for your presentation. Oh, I have a list of people who have questions. Councillor Wolf.
Through you, Madam Chair. Thank you, Cindy, for your presentation. I agree the hydromorphone model would be good, but I've heard that there are problems with the model in terms of, is it legal? or I guess that we don't have the funds for it. Do you know what problems we would have to overcome?
I don't know a lot about it, but I have read research with respect to the model being, there's a pilot in BC, and so they literally had testimonies from people who went through the hydromorphone, and then they were able to get free of addiction. And so I'm not the expert on this. I think Dr. Niekamp would better be equipped to be able to provide detailed information about that. But I think it's something that, as a council, you could still explore, and also reaching out to the province and finding out information if they're willing to fund this sort of model. And as I said, it really does. There's a better feeling with community members because it's much like the methadone.
Yeah, I agree, because you wouldn't have to worry about tainted drugs, and you'd cut out the dealer.
Yes.
So that makes a lot of sense. But and I had wondered why we weren't just going straight ahead, and I was told that at this point it wasn't legal, but whether that's true or not, I don't know.
Well, they're operating in BC.
Yeah, and as a pilot project, and with the federal government too, safe injection sites weren't legal until they passed a law saying in these cases you could have, take illegal drugs. So maybe it's something else we have to do. Thank you.
And now I have Councillor Adshay.
Thanks, Madam Chair. And Cindy, thanks for your presentation. I think I've got a pretty good understanding, but I was wondering if you could just tell us what the basic, Dr. Niecamp's basic outline of the hydromorphone method is. Could you just give it a basic outline?
And I can only give you what I've read and what I've heard. I've been at the regional meetings. I've attended a lot of the regional meetings and heard Dr. Niekamp, his presentation. But the hydromorphone, it is, like I said, they're under the care of a doctor. They don't bring their drugs in. The drugs are provided. It's even in a pill form. How that works, I'm not quite sure. And then treatment is easier. Like they're able to transition to the hydromorphone and then transition off easier into treatment. So I did some research and found out that there were people who actually went to the site, or to this hydromorphone site, and they were able to give glowing testimonies of being able to get off of drugs. And to me, it seems like just a solution that's workable. And one of the concerns is bringing dirty drugs in, and again, crime rates rising. I mean, if we really want to help people who are addicted to drugs, and we really want to make sure our communities are safe, we need this better model, because the current model, the supervised consumption site, or supervised consumption model, it's broken.
Yeah. Just a follow-up, Madam Chair. And my understanding that started in BC, and they've had there's been some real promising results so far, right? Is that correct?
No, I haven't read anything that there are problems with the hydromorphone.
No, in BC, have they started some? Have they started
yes,
similar program
yes,
in BC?
Yes,
okay,
yes.
And they've had pretty good results
yes,
with it so far,
yeah.
right? Okay.
Yeah.
Okay. Thank you.
Mayor McGarry.
Thank you very much for coming, Cindy. And I just really wanted to point out that it's the provincial government and the Minister of Health and Long-Term Care who is responsible for planning and charging the medical officers of health in Ontario on the route forward in looking at a particular course of action, no matter what the health risk is leading up to it. And that is not our role as municipal councillors. We can lobby all we want for all kinds of things, and we do so regularly. I've had many conversations with our MPPs here in the region regarding what more services we would like to see here in the region, such as detox beds, rehab beds, etc. But this provincial government has said that they are going to fund 21 consumption and treatment sites in the province of Ontario in order to help address the immediate need of those who are continuing to die in large numbers from this horrific drug. And that is put in place at the moment, from what I gather, in order to meet the immediate needs, while all of the health partners across not only Ontario and Canada and virtually globally are looking at trying to address some of the other issues regarding this particular drug. So my question to you is, are you aware that the municipality has very limited scope in what we're trying to put forward, but we can address things like prevention or working with our regional partners in order to address whether or not we have a consumption and treatment site here, so that those that are addicted to drugs can come in and have the wraparound services if they choose?
Well, Mayor McGarry, you know that I'm on the district school board. And so we as a school board, we try to work with our partners as well. But we also write letters, and we can write a letter to the federal government, we can write a letter to the provincial government, we can write a letter to city council, we can write a letter to the region. So I think that's well within your scope to write a letter, and I think that the province would be open to receiving a letter. I think it's part of your role as elected politicians to advocate for a model that will actually really help people get into treatment. And so if we look at BC, when they started with the supervised injection sites, and so we only have to go back and to realize, and then they're now exploring the hydromorphone. And the information that I've read, there's success. So why can't we learn from their past mistakes and what they're currently exploring? And so I think it's well within your right to write a letter and find out if we will receive funding for if we decide to go with hydromorphone.
Thank you. A follow-up. And through you, Madam Chair, are you aware that with the Waterloo Region Advocacy Day that all of the heads of council in Waterloo Region just went to the federal and the provincial governments in order to advocate for a number of different things for our region. We met with many different ministers, parliamentary secretaries, and parliamentary assistants. And this was very much on our agenda, and we did speak to these. And what we are being told is that the provincial government is continuing to roll out their chosen method in the meantime to place 21 funded sites throughout Ontario while they are examining other ways of helping to address this, and that our request for more mental health funds in our communities was actually not acted upon earlier this year?
No, I wasn't aware, but I think that's a great opportunity. I'm just wondering, as mayor, did you actually talk to someone at the province and promote the hydromorphone model? Like, was there official discussion amongst council to promote the hydromorphone model? Like, was that one of the things that you talked about at this meeting?
We're getting into a debate now, and I think that is not proper.
Yeah.
We will have an opportunity for council to debate the issue when the motion is brought forward.
Thank you.
Councillor Montero.
Thank you, Madam Chair, but my question's already been partially answered. But I just go, Cindy, this hydromorphone model that you were talking about, is it being used right now as we speak?
Yes.
And when did it start?
I don't know when but you know what? And this has been promoted by Dr. Nykamp at the region. Yes, it has. I've been there. I have listened to him as a delegation, and we have regional councillors here. I'm kind of stealing his thunder because this has been his idea from the very beginning. He's the coroner of Cambridge. So I would suggest meeting with him and talking.
I realize that, but What I'm suggesting is, or what I'm asking you, we don't know the results. Do you think for a minute that if the hydromorphone was a success and it's working, that the rest of us or the rest of the country would know about it? This is a thing, this crisis.
I think we're getting off